This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good morning, everybody. I think that we've done a pretty good job of starting to address opioid use disorder and recognizing people who have problems with long-term opiate use and trying to prevent problems by getting them to long-term treatment and starting Suboxone or buprenorphine from the emergency department to kind of really treat their use disorder. But we have probably a huge opportunity for doing something similar with alcohol use disorder. I think it's fair to say that we see a large number of people who have problem with alcohol use, and we frequently treat them for whatever brought them to the emergency department, just intoxication, trauma, withdrawal, and then discharge them when they're clinically sober and, say, please try to cut back. But there's several treatment options for anti-craving and trying to actually help people who might want to stop drinking. And we could easily start prescribing these, and one of them is Naltrexone, which is a interesting medication. It's actually kind of like a long-acting oral naloxone, and it prevents craving, and it's generally very safe and can be a very reasonable thing to start. Gabapentin is another option, something that we treat a lot for, nerve pain or other things. Gabapentin can prevent alcohol craving. So I think a lot of times we get people and sign out who are just sobering up in the emergency department, and it would be very reasonable to, as we're getting ready to discharge them, ask them if they think their drinking is a problem. Do they want help potentially trying to stop drinking, and offering them medications to help with their long-term alcohol use would be a very reasonable, safe thing to start in the emergency department. So, I think it's something we could do better. Any questions, comments? All right, thanks all.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.